Okay, anticoagulants that work as indirect thrombin inhibitors. These have been on the market much longer than these newer ones. They've been around for quite a while. And they don't work directly on the thrombin, they work on factors that lead to the formation of thrombin. They have been used for years to prevent new clot formation, to stop blood clots that you already have from getting bigger. They're used as a preventative. Anytime you have surgery that involves the heart or the circulatory system, many times you'll have to stop the heart and put the heart on bypass while you're working on the heart or the big vessels. And that, of course, can cause clotting. And so they're going to actually have a heparin in the circulating IV fluids that are going to prevent that clotting from happening. Patients with heart valve disease, patients who have dysrhythmias, for instance, AFib, and then patients receiving hemodialysis. Once again, the blood is circulating outside of the body, going through a lot of different valves and filters and being cleaned before it's returned to the body. So the dialysate is going to have a certain amount of heparin in it to prevent the blood clotting while it's outside of the body. And then patients who have to be on bed rest, either they've had orthopedic surgery and haven't gotten up yet, although, you know, they try to get patients up fairly quickly now. Women who are pregnant, non-bed rest, or anybody else who has some sort of a condition that keeps them sedentary for a long period of time. Or if they have a past history of thrombus formation. If you have had a blood clot in your leg or your lung in the past, generally speaking, you're probably going to be on some sort of an anticoagulant for the rest of your life. Now, heparin sodium, can't be absorbed if taken orally. It's destroyed by the fluids in the GI tract. So it has to be either given IV or injected sub-Q. So we are familiar with the low molecular weight heparins. These are given subcutaneously. They bind to antithrombin and just kind of slow down that whole clotting cascade. Now, the reason low molecular weight heparins like enoxaparin or Lovenox are recommended is because they are very stable. They have a long half-life. They don't need just routine follow-up testing. A person can take home their Lovenox or their Fragmin or whatever it is that is prescribed for them, and they can give it to them with shots at home once or twice a day. Now, heparin can also be given subcutaneously, just straight heparin sodium. It can be given too, but it's not quite as stable as the low molecular weight heparins. So generally, heparin is going to be used in the clinical setting, and for emergent situations, it can be given IV. The only heparin that can ever be given IV is heparin sodium. We never give any kind of anticoagulants IM because the muscles have so many blood vessels that a huge bruise and eventually a hematoma could form, and the person could have dangerous bleeding. So the way these drugs work is they increase the time that it takes for certain factors, in this case the heparin cofactor or antithrombin 3, to work on several other coagulation factors, and that slows down clot development. So, you know, you think of the clotting cascade sort of like dominoes. You know, if you line up a bunch of dominoes all over the place and then hit the first, they all fall fairly quickly. One knocks down the next one, which knocks down the next one, which knocks down the next one. But these medications just sort of slow down the time where one factor is working on the next factor. And so that means you're not going to form a clot quite as quickly. Now, the test for heparin to see if heparin is effective is called an activated partial thromboplastin time, or an APTT. And we will talk about the testing that is required for these various drugs in a later slide. But generally, you're going to have a PTT, partial thromboplastin time, and many times they will activate it or increase the time that the results will come. And so that's called an APTT, or activated PTT. When it comes to the heparins, heparin sodium can lead to excessive bleeding. And of course, like we said, that's our biggest risk for any of these drugs. You can have an allergic reaction. For some reason, these drugs can lead people to have hair loss. In men, it can lead to persistent erection that has to be taken care of. That is an emergent situation. If an erection forms that just will not go down, got to go to the doctor for that. And I already said hypersensitivity reaction, so I have allergic reaction. They're very, pretty much the same thing. On page 271 in your book, you have a list of side and adverse reactions. Now, heparin is not passed in breast milk. And so you can breastfeed safely if you are on heparin sodium or one of the low molecular weight heparins, unlike Coumadin, which is not safe for pregnancy and is not safe for infants, or not considered safe. The jury is a little bit out, but generally they try to keep the coumarins, the vitamin K inhibitors, away from infants and children. Now, heparin can cause heavy menstrual periods in women who are still menstruating. And so if a woman is taking a heparin and she notices that her menstrual periods are heavier, increased bleeding, and lasting longer, you should hold the heparin and call the doctor. Now, a very rare but very serious adverse reaction with heparin is something called heparin-induced thrombocytopenia, or HIT. Very, very rare, but when it happens, it can be extremely dangerous and ultimately fatal. So if you see that, it's, pretty scary. You have to be aware of it happening, even though it is somewhat rare. It can cause the platelets to just give out, and you don't have as many, and they're not as effective, and very, very dangerous. Now, once again, like the other anticoagulants, heparin mixes badly with aspirin and NSAIDs. If you have a heparin bottle and you are going to draw heparin out of it, you don't want to shake it. You want to just roll it in your hands like insulin, because it is made of proteins. When you inject the subcutaneous site, you do not want to aspirate, and you do not want to massage for fear of increasing your bleeding.